Transformational faith action for health and social justice, the guiding philosophy that leads faith into action. INERELA plus Nigeria and Christain Aid UK Nigeria present Church Advocates Model for Faith Community Health Action. Reverend Dr. Bob Edgar, General Secretary, National Council of the Churches of Christ in the USA, had this to say. And on the importance of congregational action for development, Sheikh says,
We're doing a lot of work around HIV testing, a lot of care support, advocacy and all that. We'll be doing it in different ways. But as an organization, we sat down and said, can we look out for a model that we will use that can address all issues in one? Under a project we were running with Christain Aid International, the project was promoting integrated approach to community health through actions of faith leaders and communities. So we thought to ourselves and said, what do? We want to come up with an outstanding model that can address so many issues, not just issues around ANC alone, not just issues around sexual and reproductive health and rights alone, but that would address so many issues, including issues around peace building also. So we sat down and said, what do? We came up with the model and said, okay, let's try this as a pilot, and which ran for in 3 states, and of course we are scaling up to other states too.
It's modeled after asset-based, community-led development. In this case, community is a faith community. So, and it's in line with our philosophy of transformational health, transformational faith actions for development. So, we understand the important roles faith leaders and faith communities play in our society. So, we have developed this model to make faith leaders active partners in health and social justice. So, Church Advocate model is about empowering faith communities, setting up a movement in faith communities that adopt a bottom-up approach in dealing with issues around health, maternal and child health, sexual and reproductive health, gender issues, and issues around human rights. Right? Because we know these are in the communities, and to deal with them, we have to address those factors that are in the community. And faith leaders, faith communities are very influential in shaping opinions and behaviors of individuals. And that's why we saw the result the Church Advocate actually gave. Because we feel, as sustainable as they are, as powerful as they are, it will be huge, like I always say, missed opportunity if we do not partner with them to address these issues in the community.
The Congregational Health Empowerment and Social Safety Advocates, Church Advocates, is an innovation piloted in 20 congregations in Benue and Kaduna State to intervene on maternal and child health, MCH, HIV stigma mitigation, sexual and gender-based violence mitigation, and sexual and reproductive health promotion.
And during this church program again, we are able to set up a support group of women, of pregnant women. A support group of pregnant women. The pregnant women are enrolled either in the mosque or in the church. They discuss issues surrounding their pregnancies. The men are being sensitized during the church service or the mosque prayers, so that they support their women to go for antenatal. And there were results. Very beautiful results, because all during the program, they were telling us that at least they lost 2-3 women in a month. But now, when we came in, we were enrolling the women and we were following them up to the facilities. We were referring them to the facilities, and in most of the communities, all the women we had gave birth in the hospital.
ina zuwa awo, da na haihu bayan na haihu a asibiti kuma ina zuwa ina kai yarinya na mata allurorin da ake yi na asibitin. Amma daga farko ba na haihuwa a asibiti, yanzu ne zuwan da Hajiya Aisha ta zo ta mana bayani yasa muke zuwa asibiti.
Magana akan chest advocate ba abin da zamu ce mu wannan program sai saboda zuwan shi wurin nan ya wayar mu mata da yawa kai. Yanzu kamar misalin magana zuwa asibiti a wuri, mata da yawa a wannan suna da ciki amma mace saboda babu hali ko kuma maza ba su ba su goyon bayan da za su fita su je asibiti ba, mace sai ta zauna a gida ga laluran damuwan gida ga ciki ga yara. Amma zuwa wannan program din aka kira su aka zo aka wayar musu da kai sosai, mata suna zuwa asibiti yanzu.
A key achievement of the project was establishing a sustainable movement in congregation that adopt bottom-up approach to mitigation, health and social justice, raising religious leaders as champions and advocates who challenge harmful norms and practices that amplify inequality, inequity and right violations.
The CHS program has really impacted my people positively because it has changed our orientation and mindset. And for my own congregation and many others, especially the child maternal issues, we have addressed that. And I personally have used it as a point of duty for me to preach it to my congregation, to them. So the CHS program has helped them to be more hospital friendly. They go to hospital for one problem or the other. They don't handle issues on their own. And there are so many issues that we have discussed about the drugs addicts. Yeah, we are looking into that aspect too. We are working hard on it to see how we can reach out to them. In fact, if we cannot even stop it, to reduce it to the minimum. And it has helped a lot. It has helped positively.
gaskiya ta kawo mana ci gaba sosai wanda kuma idan mu ya bude muka zamanto mun waye babu wani wanda zai zo yi mana wani abu wanda bai kamata ba mu kyale shi kurin ya tafi. Bayan haka lalle bayan ta zo ta nuna mana abubuwan da ya kamata mun kuma tsaya mun yi tsayin daga akan hakan kusan har muka kai lokacin da muka kai yanzu na ci gaban da muke kai wanda da kusan kowa ma ba ruwan shi kowa yana yin da gari ya waye kurin ba ruwan kowa da kowa ba ruwanka da makocinka ba ruwan shi da kai. Amma kasantuwar zuwan wannan al'amari ya zama to kusan an zo an haɗi wannan na taimakon wannan yana taimakon wannan yana taimakon wannan.
Religion is the main factor in decisions Nigerian people make about most issues in their lives, and the trained religious leaders led faith community mobilizations and demand creations for MCH, HIV and SRH services.
My experience working with other community or religion is that now there is a relationship and there is understanding. Before, we used to see each other as enemy, the Muslim and the Christian. But because of this CHS advocate, we understand that we are one. It is only some people that are trying to divide us so that they should rule us. But now we will not understand. And by that training, there is the conflict that we had before between the Muslim and the Christian or between other communities. That one was settled. Because on that training, we understand that we are all one and we should not fight each other and we should work as a family. So that is one thing I achieved in that training.
cewa kai musulmi za ka zaɓi fasto wanda za ku zo da ku zaɓe da shi, wanda duk shawarar da yake da shi zai baka tarihin shi kai ma ka ba shi tarihin ka. faɗa abubuwan da kuke a nan shi ma faɗa muku abubuwan da kuke da suke a can wanda haka muka yi wannan zaman na wuni biyu kuma gaskiya wannan zaman mun samu fa'ida da yawa.
Yeah, with the imams, some of them that we met with them there, I can see that the problem that they probably have on their own side, we always have them here. The Muslims, they also have this problem of gender-based violence, raping, and child abuse, and the rest. We also, on the Christian side, we have the same issues. And that's to tell us that with these issues, since we are human beings, actually we need as leaders, church leaders, the Muslim people, the Christians, we need to work together in order to say that these issues have been taken care of.
Lokacin da muka zama da su, ran da muka je ban yi tsammanin cewa za mu zauna da wasu wani addini bane. Mun yi tunanin cewa kurin mu ne kurin musulmai kurin za mu zauna a gurin. Muna zuwa sai muka kurin ai ga malamai ga fastoci wanda rabon da na ce na yi irin wannan zaman yau ga malam ga fasto ana tattaunawa gaskiya na manta. Lallai na ji daɗin abin kuma mun raba cikin jin daɗi muna fara a kusan har yanzu akwai fastoci waɗanda muke mu'amala da su mun sukan kira ni mu gaisa da kira su ma kuma mu gaisa da su wanda gaskiya na ji daɗin wannan abin sosai gaskiya kuma inda ana samun hakan lallai za a rinka samun fahimtar juna ni ba zan kyamace shi ba shi ma kuma ba zai rinka kyamata na ba illa kurin kowa ya addinin shi ne addinin da kai da shi ka yi shi ne ma wanda ne da shi din yin shi sannan kuma mu zauna muna zaman yan uwan juna ne tunda da tun kafin irin wannan rikicin ya faru tare ake za ga ɗakin musulmi ga ɗakin wanda ba musulmi ba ana cin abinci tare ana zama ana yin mu'amala tare amma tun da wa'annan rikicin na addini ya fara tashi sai ya zama kurin kowa ya ware ya koma gefen shi daban amma lallai kasantuwar haɗuwan da muka yi su lallai mun kulla wani danƙon zumunci tsakanin mu da su wanda har yanzu muna zumunci da su har yanzu.
Chairs advocates in the different congregations leverage their congregation platforms to mobilize pregnant women in learning sessions and advocated for removal of gender barriers that limit their access to health care. Even the silence on menstrual hygiene.
The menstrual hygiene component of this church program was that when we talk about menstruation, there's stigma attached to it. And there's this I don't care attitude of parents towards menstruation. So we had a program on TV about menstrual hygiene. Women, especially the mothers menstruate, but they forget that their daughters are menstruating. So most of them, when we went in and sensitized them, we asked them, we found out most of them don't even buy sanitary pads for their daughters. And when we were asking the daughters, we found that they had to go to their boyfriends to buy sanitary pads for them. And especially in some communities, they were using rags, which is unhygienic, because when we wanted to know how they clean the rags before they used it, they just tell us they will just wash it and spread it. So we sensitize them on how to even sanitize the rags using ions, processed and other detergents. Then we also, during that, we also there are some that have never used sanitary pads. So we gave them, we distributed sanitary pads for them, so they will start using it. And we sensitize the parents to make sure they at least help these girls with sanitary pads.
Also, an yi mana program na Church Advocate a nan ba so ne ba so biyu ba. To alhamdulillah mun samu amfani da dama saboda an koya mana yadda zamu in baka da hali in al'ada ka yazo ko baka da fat zaka samu summa ka wanke ka shanya shi a rana kana gogewa kuma ƴaƴan da muka haifa mu dinga koya musu ba kunya saboda wasu iyaye suna kunya har ƴaƴan su fara lafiya ma ba su sani ba sai dai wani ne a wajen maza ma wani lokaci suke koyar da su wannan.
Indeed, it will be missed opportunity if we fail to leverage the huge resources in terms of material and human capacities therein to challenge the vulnerabilities that affect the dignity of men, women, the young and the old in our communities. The question is, can we identify ways to broaden this intersection between the faith practices and public health in our communities? Yes, we can.